Uh, Thank you so much, Shubhashri, for uh, giving my info. Yeah, am I audible?
Yes, you're audible.
Yeah, yeah, okay, fine. I'll just share my screen. Yes. So first of all, I want to thank you, Vedic Wellness University, for inviting me as a keynote speaker in such a noble conference. So I'll start with my session. The session is of Ayurveda and music therapy for wellness. So, what is Ayurveda? So I'm a student of Ayurveda. I have done my master's in Ayurveda. So I'll say just few things about Ayurveda. That Ayurveda is a science which connects spirituality. So when spirituality and the science connects, it becomes Ayurveda. So Ayurveda is known as the life science. Ayu means life and the Veda means science. So Ayurveda aims at the preservation and promotion of health and prevention and cure of the diseases through the concepts of positive physical as well as the mental health. So Ayurveda has given very much importance to the mental health as well as the physical health. Even I'll say that they have given more to mental health than the physical health. It's 7 o'clock. And special importance has been given to a mind in Ayurveda. Very much quotes are there for the mind in Ayurveda actually. The mental health has been described in a brief way in Ayurveda actually. So Ayurveda emphasizes the importance of mind, that is Manas Prakriti, in the existence of life. So few mental disorders, manasik rogas, manovikaras, we can say that. Ayurveda has described, and they have described some therapies and treatments for those mental disorders. Ayurveda has described unmad, that is, we can call it as a schizophrenia, apasmar, we can call it as a epilepsy, that is a neurological disorder. So these kinds of mental disorders Ayurveda has described, and for those disorders Ayurveda has suggested us some treatment parts and some therapies. Like they have suggested Satvavaja Chikitsa, that is, we can call it as a Ayurvedic psychotherapy. Then Daiva Vapashray Chikitsa, that means a spiritual therapy. Then Adravya Chikitsa, that non-medicinal treatment, that counseling and all, what we do in our practice, that counseling and all is included in non-medicinal treatment. Then Yukti Vyapashray Chikitsa, that means use of Ayurvedic medicines in the treatment of the mental disorders. Then Pratidvandva Chikitsa Siddhanta means the replacement of emotions by contrary emotions. This is what we want in music therapy. When we use music therapy in our patients, we want the replacement of emotions by the contrary emotions. And the music therapy, last but not least, the music therapy falls in almost all about types of therapy. Music can be given as a Ayurvedic psychotherapy, music can be given as a spiritual therapy. When we use mantra chikitsa or Omkar chikitsa in the form of music therapy, we can call it as a spiritual therapy. In the counseling, along with the counseling, I actually do the music therapy. Use of Yukti Vyapashra chikitsa with Ayurvedic medications also, we can give music therapy to these patients. And replacement of emotions, I'll talk about this point later. So what is music therapy? We all know that the systemic use of music within a therapeutic relationship which aims at restoring, maintaining and furthering the emotional, physical and mental health. So when we give music therapy to our patients, we should know that the emotional quotient, the physical and the mental quotient is very important in music therapy. So music therapy, we do it by two types actually: active music therapy and passive music therapy. In which the active music therapy, patient actively participates in music therapy. Actually, when a patient comes to us for a therapy or a therapy session, he actually participates in that therapy. He sings with us, he plays an instrumental instruments with us. That means I'll say that he actively participates in that therapy. And in passive therapy, the patient will just listen to your music or just listen to your vocals, whatever you will. So what are the historical references of this music therapy? So some of the historical references are from India, that Akbar and Tansen, this is very famous example that in the Darbar of Akbar, Tansen used to sing rags and Indian classical music. And in Second World War also, music therapy has been used for the soldiers for their pain management. This is very nice historical reference, I think. Then Hippocrates, who is the father of medicine, he has used music as a medicine. Then lullaby or Kaya Git, whatever we call in Marathi language, that lullaby is a good example of music therapy, which every day a mother gives to her child. Then Garbha Samskar or a Garbha Sangit, that music therapy in pregnancy. Ayurveda has a strong reference of this Garbha Samskar, and we use the music therapy in pregnancy. So in Egypt also, the use of music to lessen the pain of women during the childbirth. So this is very one of the good example of music therapy. So how does music therapy works? So in a scientific way, I'll tell you that music produces a psychological responses within a person when it passes through the auditory cortex. That means when it passes through the ears, it goes to the auditory cortex of the brain, which processes the music. And there is one system in our brain, that the system is called limbic system. And the limbic system is the center of emotions. The all emotions which we get in our day-to-day life, the limbic system is the center of emotion. And music plays an important role to control that limbic system, and music controls that limbic system. And when I call that replacement of emotional therapy, we actually work on the limbic system of our brain, and we do that in a music therapy. So this is some theoretical part of music therapy. I'll just not go in that so much deep in this. That according to Natya Shastra, they have given 8 rasas, that Bharat Muni has given us 8 rasas. So according to them, we can replace those rasas or emotions by music therapy. I'll give that example in further. I have done the studies in this, so I'll give that example. So Ayurveda and music therapy, some of the references I'll give you, that Ayurveda has 3 doshas, that Vata, Pitta, and Kapha. So for to decrease the Pitta dosha, they have given the reference of music therapy. Acharya Charaka has given the reference of music therapy, that we should listen to a good music, a pleasant music, to decrease the Pitta dosha. Then in the treatment of Nidra Nasha, that is insomnia, Charaka has given Manaso Anuguna Shabda Chikitsa. That means music which is pleasant to your mind, or a music pleasant to your ear. You should listen to that music for the insomnia condition. In Sutrasthana of Acharya Charaka, he has given the Sumanaskaha Garbhadharana, means the in Garbhadharana, Sumanaskaha is very important. The Ayurveda is actually in a Sanskrit text, so we have to do that study of Sanskrit also in this. So Sumanaska Garbhadharanam, that is a pleasant mind, is very important in Garbhadharanam, and for pleasant mind, music plays a very important role in this. So how music therapy we can use, and how I use music therapy in my day-to-day practice. So I use Omkar chanting, I use mantra chanting, I use instrumental music for a music therapy, and of course a vocal music. So what is Omkar chanting? The Om is consisting of 3 words, A, U, and Ma. That is U, and Ma in Om. When we sing these 3 words, they have the special importance. So it's actually a very broad concept actually. For this, actually, we'll need one session for that. So I use Omkar chanting for this. Then mantra chanting. Mantra means what? The man means to think, and tantra means, or tra means the tool. So it literally means the instrument of a thought. It means mantra. And we all know as Gayatri Mantra or Hanuman Chalisa or Ganapati Stotra, it's very useful, and research has been done in this for music therapy also. And I use the mantra chikitsa based on the raga chikitsa. So all we all Indian classical music is framed in a raga chikitsa. So we use, even I use Raga Chikitsa as a music therapy, and for Mantra Chikitsa also I use the Raga Chikitsa in that. Then comes the Raga therapy. What is Raga? So the sequence of selected notes, that is Sa Re Ga Ma Pa Dha Ni Sa, and the sequencing, correct sequencing of that, and is known as a raga actually, which elevates our mood. There are many ragas in our Indian classical music, and they have that power of replacement of emotions, or replacement of any mood or something like that. So I'll just tell you the few things. What is music therapy? That music therapy, how it helps actually. So music therapy to help the develop the communication, language, and intellectual level. Music therapy to lower the stress and tension. This is what I have done the research in this. Then music therapy as a motivation for rehabilitation. Then music therapy to encourage the movement. This we can see in the autistic patients, that autism patients. Yeah. So I have done this research that Rag Darbari Kannada for insomnia. As I see that Acharya Charak has given us the reference of Manaso Anuguna Shabda Chikissa. So I have used that Manaso Anuguna Shabda Chikissa, that is the Rag Darbari Kannada, which Tansen used to sing in the court of King Akbar for his stress relief and for his insomnia. So this has a specific reference in the ancient texts which I got. And so I have done the Rag Darbari Kannada for insomnia. I have got excellent results in that. Right now, I have more than 1,000 patients of this research. And I have done this research in only 30 patients. And right now, I'm using it in more patients. So I have the data of more than 1,000 patients of this Rag Darbari Kannada for insomnia. And in a mild and moderate kind of insomnia, we get excellent results from this. Then music therapy in pregnancy. So I have used this for 9 months of a pregnant lady. So I have taken the 30 pregnant women as a data in this research. And for the research was actually considered as the, in the first trimester, the research was, or the music therapy was mother oriented. In the second trimester, the music therapy was fetus oriented. And in the third trimester, both mother and fetus are oriented in our music therapy sessions for the research. So while like this, the first trimester is mother oriented, and second is fetus, and third is both of us. So Ayurveda has given us the reference that the development of child, or the mind of the child, will grow from the fourth month of his growth, fourth month of his development. So for the first 3 months, the hormonal changes will be there in the lady. So for first 3 months, we should consider the lady first, that mother-oriented music therapy or mother-oriented treatment also we give to the patients. Like in Ayurveda, I also give treatment to these pregnant women. So when we give the treatment, we always consider as mother-oriented for first trimester, second trimester is for fetus-oriented, and third trimester is both. That means the mother will have two hearts in her body. So we'll have to look after those two hearts, and for those two hearts and those two man, we call. So we have to consider as music therapy for both mother and child. So recently I have done the research in this, that Rag Yaman in depression. As we all know, Rag Yaman is very much famous for his pleasant effect of Rag Yaman. Depression in Ayurveda, we call it as a Vishada Rog. It's a disease caused by Vata disorders. And I'll just tell you the theory of this. The Vishada is caused by the Vata disorders. Rag Yaman, we sing the Rag Yaman, the Gana Samay of Rag Yaman, what we call, is actually late evening or the evening time from 6 to 8 or 6 to 9, sing the Rag Yaman. And the evening time, or this time 6 to 8, is a time of Vata disorders, or Vata increases in this time actually. So in the Vishad or in the depression, I have used Rag Yaman, but I'll say only in the mild and moderate kind of depression, I have used this Rag Yaman as a music therapy in the patients of depression. I have the data of 70 patients who I have got. From that 70, 92% of patients have got excellent results in their mild and moderate type of depression. So I'm using this music therapy since last 5-6 years. So I have done this research from in the insomnia, in the pregnant women, in depression. I'm doing my practice in a palliative care and the mental health. So in a palliative care, day to day, I go with the cancer patients. I treat neurological patients like autism and epilepsy and dementia and Alzheimer's diseases. So I use Ayurvedic therapy, that is medicinal therapy, with the music therapy to those kinds of patients. So I have used music therapy in autistic patients, mentally retarded children, palliative care, that is COVID patients. I've used this music therapy in COVID patients for 200 COVID patients. For a month, I have used this music therapy by going through their quarantine center and using the music therapy. And of course, in the neurological disorders, I have said that I'm using the music therapy regularly to these kinds of Alzheimer's and dementia and epileptic patients. I'm right now doing a big research in a big hospital in Pune on the epilepsy and music therapy, and it's going really nice. So this is my site Music Here. You can see musiccare.in. So I have these two apps that heal with music and music therapy in pregnancy. This is one of my another site, which is a blog site of Ayurveda. You can all see the blogs, Ayurvedic blogs, which I have written by me and my wife on this. And so how to be a mentally and physically fit human. So these 10 points I have to say one must learn and one must follow. That talk it out and share. Laughter, we know laughter is a good therapy. So daily yoga, pranayam and walk, then meditation in tea breaks, music therapy in tea breaks, eat healthy and in time, proper sleep, fresh air, adopt Ayurvedic lifestyle, and don't control your natural follow for his wellness of mental and physical health. And lastly, I'll thank you again, Vedic Wellness University from Florida, USA, and Mr. Krishnamurti sir, Krishnamurti ma'am also, for giving me the chance as a keynote speaker in this very unique and noble conference. And I'll definitely share some of my things and some in detail actually in further conference or in lecture. Thank you so much. Thank you for inviting me. Thank you.
Thank you, sir.
Thank you.
That was
Excellent work, Doctor.
Yeah.
I think, yeah, so you have done congratulations on your great work.
And we are fortunate to have you today with us.
Yeah, thank you.
To get so much of insights on wellness along with music.
Yeah.
How can music create wellness in our lives? Now I would request Dr. Vijay Lakshmi. We are going to have a panel discussion on music.